This is Dr. Matthew Bramlett, and what I'd like to do now is show you a little behind the scenes around our module. So what you have in front of you is an example of our case presentation format, which includes a series of two-dimensional assets. For example, you can see the EKG over here. This is a looping video of a patient who's not in distress. Here's a looping video of the patient's vitals, which we pulled from the Sim Center's Camtasia functionality. But really, all this is, if we kind of look behind the scenes of what we have, is a series of assets that we were able to record in the Sim Center using standardized patients. And remarkably, whenever you put the patient sort of in the position that makes sense, you can really get to a great state of realism, including just our pictures of the bed and as well as some of the other assets that we have in here, like these videos. So I'm going to press play and just give you a sense of how Dr. Mishler, who is the educator in this scenario, this is where he was when he was teaching the early stage presentation.
All right, now let's jump into the bedside assessment of our patient now that we have our history taken. I've put the history over here for you. You can enlarge that if you need to review. The first thing I want you to notice as you walk into the room is how your patient is positioned. And this is a very important first assessment that you will make from the door. You can see.
So he's going to go on to describe the early stage presentation. And what we have here is we've created a reproducible format for the EPA10 guidelines of the assessment of the patient on this format. And I'm going to skip past moderate and several of the debriefs. We have the assessment questions built in, and I'm going to move on to the severe presentation here, which will allow us to understand the capability of this format. And so now, if we move over here, we can see now that our patient is in more severe distress. And you can see that where you can see now how he's breathing more heavily, he's sweaty, he has poor cap refill, which is just another different, this was me after my hand had been put in ice water for a while. But let's watch Dr. Mishler describe the scenario in this moment.
So we attempted vagal maneuvers and medication with our patient. Neither one terminated the SVT. As we now move to the bedside to reassess our patient, we see a change in his clinical status. We see his mental status diminish. Notice his eyes are closed.
So he goes on to describe different mechanisms. He can even run through part of the pad placement as it relates to getting the spark to go through the heart in the right direction. This is just a quick glimpse behind the scenes of our EPA10 modular format for case presentations, walking through early, moderate, and severe or late stage presentation of acute illness. Thank you.